About what we'll be sharing today has to do with our mouths. So, some of you may be aware today is March 20th, which is World Oral Health Day. Dr. Amy Thompson, a medical laboratory scientist and a health advocate. And with me today in my channel is no other person but Dr. Indibisi. Let's give you a round of applause for joining us. So, Dr. Indibisi, you're welcome. So please, can you introduce yourself to my viewers? Because after
As Dr. Thompson said, my name is Dr. Ndubisi Nwangwo, and I'm a dental surgeon.
Okay, so he's a dental surgeon. The theme for this year is a happy mouth, a happy mind. So thank you, Dr. Ndubisi, for being with us. And I want you, because when they say happy mouth, happy mind, you wonder how does the mouth connect with your mind, your mental ability. So I want you to throw more light on how a happy mouth is a happy mind, especially currently we know that we have been facing a lot of mental health issues around. So can you just tell us how the mouth connects to our minds? Thank you very much.
Okay, thank you. So by answering the question, the mouth is actually a mirror of our body. So what is happening in your mouth shows what is happening in your full body. In fact, there is currently no systemic condition or disease like diabetes, HIV that doesn't have oral manifestation. So that's why we say that the mouth, when you have a happy mouth, you have a happy mind, especially when it comes to mental health. Most people are not really living to the fullness of their health. You know, World Health Organization Division of Health excludes the absence of sickness, also concerns the mental health. In the same vein, mental health in the dentistry is also there, because if you are not happy, you are not physically okay with what your teeth looks like, is giving you psychosocial issues, then you are not happy. So that's why we are bringing it home to sensitize people on the importance of their mouth, what your mouth looks like. You can actually modify it by treating you and make you feel okay. Most people want to commit suicide just because their teeth is not arranged well, or because it's discolored and they don't know where to go and seek help. All those things have treatment already. So we want to sensitize people. So most people, in terms of mental health, people that have a good dentition, most likely when they smile and people are happy with them, they are not mostly depressed, except maybe other things. But physically, by their look and aesthetics, they're okay.
That's actually a very interesting point, because as you said, when someone has a good smile, for you to present with a very good smile, that means you have to be comfortable with your oral hygiene, your dental, and the way your dentitions are arranged. Because you can see some persons that maybe they have issues with their mouth. They are always bending their head, trying to hide it. So it's true, it gives to someone that has a very good oral hygiene and very well placed dentition, they tend to have this confidence. So I can now see how how a happy mouth is related to our mental health. Thank you very much. Yes, we'll be moving on to the next question in today's episode, and this will, we have a various oral health conditions, but because of time, I'll be focusing on one that once is troubling somebody, it's easy for people to see, and that has to do with mouth odor, halitosis. So I want you to help us, because I know a lot of people are suffering from this. Now, what causes mouth odor, and how can mouth odor be prevented, or will I say, if those that have it, how can they control it?
Okay, thank you. Most times, halitosis or bad breath is common. It's generally stated that once you see 4 people, 1 among the 4 has halitosis. So it's common. So halitosis is rampant and is also giving people depression and the mental state. So now, what causes it majorly? When a patient presents, actually there are many things can cause it. Can be from the dental origin, from the teeth. Majority, let's say 80% is dental origin, but it can also come from other places like upper respiratory tract infection or gastrointestinal issues, or people that have other conditions. Even people that are diabetic, when they speak, you can perceive the ketone breath if it's not controlled well. So you see that the mouth is generally connected to the mouth. So those people, but majority of the people that have halitosis mostly from dental origin, which mostly springs from poor oral hygiene. If someone is not taking care of their mouth well, cleaning it the way it ought to be, cleaning it regularly, person most likely is going to have plaque and calculus accumulation, which will give bad breath. Other things that can cause it: dental caries, tooth decay. Someone may have a hole in the teeth, and because the hole is deep, just like this dish is deep, so when the person brushes, the food still remains there, stay there, decay, and will produce some foul smell. Also, other things like when people eat too much spicy food like ginger and garlic, it will always come out in their breath too. Then other conditions like smoking, people who smoke, alcohol, all those things causes bad breath, and other medical conditions like liver disease, kidney disease, all those ones can also manifest as halitosis. But the major issue is that when the patient comes, you look at the patient. If it's from dental origin, we try to find out what is causing. If it is just dirt accumulation, because some people look at their teeth to see yellowish deposits, those things are plaque and calculus, or what they call tartar in America. It can actually, it's a biofilm that has many bacteria that can actually produce sulfonic substances that can cause bad breath. So in that case, when we look at, if we just deposit, we do washing. When we wash the teeth using our ultrasonic machine, we'll clean up all those deposits, the person will be okay. If it's springing out from cavity, then when we fill the cavity, the person will be okay. If it's from gum disease or periodontitis that is causing maybe, and there is an abscess in the mouth, it will always smell, or all those periodontal. So when we treat those things, the person is okay. Then if it is maybe from other parts of the body, we can then refer to the general physicians who go further and get it treated.
Okay, so thank you very much for this. So, basically, you need to see you need to come to the hospital, to come to your dentist, so they'll be able to find out what. So, if you or anybody close to you has a mouth or known as halitosis, the best way to find out how to treat it is actually to know what is the cause from what he's saying. And once they know the cause, and they'll be able to treat the cause, and just know that it is treatable. So don't hide, don't allow it to make you get depressed. Just come to the clinic, see your dentist, and once they find the root cause of that mouth odor, it can be solved. So be rest assured that there is a solution to mouth odor. So we are about rounding up, but because this is World Oral Health Day, I want you to show a general overview of what we can do to promote good oral health hygiene, because I know that this should be our focus. How can we promote? Because since a happy mouth is a happy mind, we need to promote that happy mouth by promoting good oral hygiene. So what advice can you give to my viewers that they can put in place to ensure promotion of good oral hygiene?
In terms of our World Oral Health Day, which is celebrated on the 20th of March worldwide, we want to drive this point home to people both in the villages, anywhere. People need to be aware of their oral health. They need to see the dentist at least twice a year, 2 times a year. So every 6 months you should see your dentist. Then we also advocate that people should brush twice daily. So you brush in the morning after eating, and brush last thing after eating in the night, so that your mouth will be clean. Most of the dental conditions you have maybe happen in the night, especially tooth decay, because the saliva in the mouth helps to cushion the effect of the bacteria you have in the mouth, because saliva has some lysosomal enzymes. So in the night, the saliva secretion is reduced, so most of the bacteria have time to act. So we will try to let people brush twice daily and see the dentist twice a year. So if someone, maybe you are far from where you can see a dentist, if you are brushing twice daily, you may not really have much. You can see a dentist once in a year, no problem. So that's basically what we try to advocate in this our World Oral Health Day. Okay. Let people know they need to see the dentist.
Thank you very much, Dr. NDDC, for having this wonderful session with us. So we can all hear that there is a part me and you can play to ensure that we promote good oral health hygiene. And you can see from what he said, it's something that you do. We brush at least twice in a day, and in the morning and in the evening. And remember, it's advisable to brush in the morning after meal, so that most times when you brush after, if you brush before you eat, there's still going to be food deposits in your mouth which will stay for a long time that may cause other issues. I'm sure he knows better. So we are advised by our dentist, which is by our side, and he's a dental surgeon, that we should brush in the morning and the evening. And I think we were told that it's preferable to use
medium or soft brush.
Yes, medium or soft brush. So please, and there's also how long we should use our brush. What do you advise?
3 months. 3 months is okay. Once you use a brush, 3 months is okay. Then if you're using your brush and you notice that it's like this now, like this, yeah, you know that one needs to be changed. And luckily, brush is not that expensive, so.
No, sometimes these things are not expensive, but some of us can use one brush for 2 to 3 years.
No. 3 months is good.
So you can hear from our dental surgeon that it's advisable to use your toothbrush. You should change your toothbrush at least once in 3 months. So please, what we are asked to do to promote this good oral hygiene is not too much. And we know that when we have good oral hygiene, we have good dentition, we have good our breath is smelling fresh and fine, it's going to boost our confidence. It's also going to ensure that we appear confident and have good mental health hygiene. So thank you very much for having you in my studio or in my set this afternoon, and thank you once more for my viewers. And as usual, feel free to suggest more health talks and more health conditions you need explained. And if it's things that I know we need a specialist to handle, as usual, I'll invite the specialist to our channel to explain better for us. And feel free to, don't forget to subscribe, like, share and comment. See you same time next week. Bye.
Bye.